I personally never used yet the Sinus Defense 2.0.
Oh,
Have
I love
you?
it. I love it.
Oh, you
Oh,
do?
yeah,
Can you
okay.
share more about it?
So, this is also, a homeopathic, but it's for under the tongue. I'm a baby, so I can only do sinus sprays once per day, and I usually do it in the morning, but then at night, especially in the winter, it's really dry, and then my sinuses get all clogged, and I, have a hard time breathing when I'm sleeping through my nose unless I use this. I mean, literally one spray and I can, like, breathe again.
Really?
I
Do you
think
think I should use this for I just had a patient who had Marcons come up. I could just
Oh!
do that, right? Because it's just gonna it says here in, a way to desensitize the body to fungal pathogens. That's what this product does, Sinus Defense 2.0. The transfer factor in the sinus defense helps the body identify and tag fungal pathogens to decrease reactivity and helps lots of sensitive people who can't start with antifungals yet. That's super interesting. Do you think that well, I guess when I was asking about Marcons is a bacteria, but most people who have Marcons get it because of mycotoxin illness. That's the
Yeah,
reason that
and
most
it's
people have
probably
it.
hanging out in
So
the biofilm with it, you know?
yeah, right? I can't see how this would hurt. Oh, that's awesome. So I'm so happy you use that. I haven't used that yet because they're always like, wanting to stick stuff up their nose to feel like it's getting up there, but you could spray this in your mouth and it's still because it's homeopathic. It's doing the thing for the sinuses.
Yeah, within a few breaths, I was like, "Oh my gosh," and,
Wow.
um oh gosh, what I was just gonna say oh, you remember in med school when we're learning all our physical exams, we're supposed to, like, stick the light up
Yeah.
and look in the nose, and then we're like, the turbinates are boggy, alright? So it's like these whirly, whirly things inside your nose that kind of push air through it to A, get rid of like, to trap toxins, right? But then also to moisturize the air, blah, blah, blah. But if they're inflamed, they get kind of boggy. So I imagine that as kind of like if you had a sponge that's like the difference between a dry sponge and a wet sponge. But that's like inflammation. That also kind of happens, I think, in the lining of your sinuses and then in the lining of your nasal passages. It gets boggy, it makes it hard to breathe. But I feel like when I take the sinus defense, the bogginess I feel like decreases and I can breathe better.